was awful to see, actually. She was stood up. I just watched the colour fall out of her face.
I mean, the doctor was quite honest with me. He said you could go tomorrow, or you could live 10 years.
Sometimes I feel a bit brain dead, like stress. There's a lot of tension around, like a cloud on my head sometimes.
Are you okay? Sorry, you look a bit emotional.
Yeah, sorry.
No, tell me what you're thinking.
Just, I've always been told that I can't have anything, so...
I've loved being a nurse, it's a wonderful job. I started my nurse training about 42 years ago. I work mainly with women and children, and I feel really lucky to be able to do that. It's such a varied job. You couldn't possibly get bored, and you learn something every single day.
Oh, I love your nails.
So did I, until I've ripped one off.
Oh no.
That's why I'm here. Like, my entire nails come off, not just the acrylic.
Oh.
So just like, ooh.
How did you manage to do that?
I was just shut in my cupboard. I was so heavy-handed, so I just...
Oh, bless you. They look lovely.
Thank you.
Is it Felicity?
Yeah. Am I coming in now?
Yeah, in you come, my love. Take a seat, Felicity.
Thank
I'm Debbie, I'm a nurse practitioner.
Nice to meet you.
You've had a bit of a trauma.
Yes, I've pulled my entire nail off. It's not just the acrylic, but it's stuck and I can't get it off. It feels like my finger's going to explode.
That must be so painful.
It does hurt.
And it's come off nice and clean, and it's attached still at the bottom. And unfortunately, there isn't a right lot you can do with it at the moment.
Okay.
Okay? Once it sort of heals underneath and settles, then you'll be able to cut that off. I couldn't do anything today at all because that nail bed is still attached. Once it all settles down a little bit, then this bit is completely off, so you would just cut that off.
Okay.
But it's too painful for you to cut it off today. I'll put you some tape over it, because there's no sign of any infection, it's nice and clean,
Okay.
and that will keep that nail. I might just put a little bit like that as well. And then you're not gonna catch that nail on anything. There's always a chance that this could get infected. And if it does, the skin all around your nail and on your finger would be red and hot and throbbing, and you would need to be seen because you'd need some antibiotics.
Yeah, no worries.
Is that okay?
Yeah, that's fine.
Okay.
Thank you very much.
All right, all the best, my
Thank
love.
you.
Okay, see you later.
Bye-bye.
Bye-bye.
How are you doing?
I'm fine, I'm good.
Good.
Trying to survive.
Aren't we all? Tell me why you're here today.
2.5 weeks ago, I had an accident
Okay.
that involves about 3 cars. So I hit my chest.
Okay.
And my neck here is got like a lump inside.
Yeah.
That's the bed. The
okay.
chest on the. I was completely in pain, in agony. Within that week, the pain is still there.
Yeah.
If I do like this,
You can feel it.
I
Yeah.
can feel it.
So were you driving your vehicle?
I was driving.
You were driving. And do you know what speed you were doing around?
Oh my God, I didn't speed at all because I've just observed
Yeah, yeah.
traffic lights.
Yes.
Then I turned right.
So did he hit you head on?
He hit me,
Right, okay.
We-
And you were wearing your seatbelt?
I was wearing the seatbelt.
Let's have a look at this, shall
Yeah,
we?
please.
So I'll start with your neck, if that's
Yeah,
okay.
yeah.
I'm just going to come round the back.
There.
Okay, and just try and relax. If you just look straight ahead for me.
It's on the right hand side, It's a bit backward. A bit.
This
Yeah. It's bigger than that. I think I started pressing it with a palm or something.
Okay, we'll talk about that in a second.
Yeah.
And then tell me
This
where in your chest
chest,
again,
yeah.
please. Around here.
Yeah.
Okay, and again, just relax for me. I'm
I've
just
got-
going to press on the...
Yeah.
How does that feel?
Yeah, I think it's inside. Yeah, that's it.
Around here.
Yeah.
And then if I press
Yeah,
on
that way. Yeah, that way.
Jesus.
Yeah.
When you're in an accident like that and you've suddenly jerk forward, and if you've hit anything like the steering wheel, you're going to get muscular damage there.
Oh, God.
And I suspect when you're talking about when you move and lift your arms, you're getting the pain. That's because you're using these muscles there to do that stretching movement, and that's what's causing the pain, because they're still inflamed from the accident, even if it was, 2.5 weeks ago. Yes. It can be 6 to 8 weeks before that can settle down after an accident.
Okay.
Now this here, this little lump that you can feel there, that is one of your lymph nodes that has come up. So one of your glands that have come up there.
Yeah.
Now rubbing it and fiddling with it will only make it worse. So the best thing to do is just to leave that alone. That can be caused by infections, it can be caused by trauma and accidents like physical trauma as well. So I suspect that the belt might have gone over that there and just inflamed the lymph node. It will go down on its own. It's nothing.
It will go down on its own.
Now, ibuprofen is good because it's got anti-inflammatory properties, but if it's not controlling the pain, we can prescribe you something called naproxen, which is a stronger tablet from the same family.
Okay.
But it's up to you if you're happy to continue with the.
Yeah, I think I want something stronger.
Yeah, let's do that. Is that all right?
Yeah, that's fine. Yeah.
I'll send this prescription across.
Thank
and
you
it
very
should
much,
get
sir.
sorted. Lovely to see you.
Yeah, thank you. Thank you, sir.
Take care.
Have a lovely one.
Thanks.
Sir.
Bye-bye.
All right, cheers. Thank you.
Hi, is it Corey?
Yes.
Hi, come on
Hello.
in. Come and have a seat. I'm Dr. Beecraft.
Hello.
All right. Whoops. Oops, dear.
Different chairs.
Different chairs. How can I help you today?
I've just been like on my period really for like, I had my contraception changed because it was I was bleeding quite a lot then, and then I had it changed in January, and ever since I've just been constant.
Okay.
It's not been a day without.
What is it you're using?
I'm on now microgynon.
Okay.
I was on the implant previous.
How long did you have your implant for?
3 years, and then I then started a new year.
Yep.
I think I only lasted about 6 months on it.
And
because
you
it
were
was
having lots of
just-
problems
yeah,
with that
so,
as well?
yeah.
Is it like a period is in red and heavy, or is it lots of spotting and brown discharge? Or?
It's 5 days of the week. It's like a full period. Like I will have to use a tampon every day.
Okay.
And then 2 days, maybe 3 at a push, it'll be like the brown. So then I'll be excited because I think, oh, maybe it's going.
Yeah.
And then no, then it just comes back the following week.
And how was your morning?
Yeah, the morning was good. Young girl with kind of period problems.
Your area of interest.
My area
as well,
of interest,
yes.
so that was good. Bit of women's health.
In terms of sort of gynae stuff, when was the first day of your last period?
Just over a week ago.
And how many days do you bleed?
I bleed for 7.
I've got one with issues with periods and bleeding.
Shall I trade you?
Yeah.
When were you expecting your period?
7th of June.
7th of June, that was your last period? Okay, fine.
And do you use contraception at all?
Yeah, I'm on the pill.
The pill that you're taking, the idea of it is that it should stop your periods whilst you're using it.
What about periods and things?
Don't have them.
Okay.
That's because of the pill.
Okay.
And how are you using your pill? Because people use it in sometimes a bit different ways.
So with it, I know that you can take a break with this one, but when I went to the sexual health place and got it from there, and they said just to take it continuously to see if that would work.
And are you using it as contraception, or are you just trying to use it to manage your periods with?
Kind of a bit of both. Yeah.
Fine. And when you went back to the sexual health clinic, did they do swabs or checks for anything else at all?
Yeah, they did. They did it. I don't know what it was for, but everything was fine.
How long ago was that?
Probably about 3 months ago now.
Okay, and will you have had a new partner since then?
No.
It's most likely that this is coming from your contraception. Okay.
Yeah.
And sometimes what happens is the combination of hormones just needs to kind of get itself into a balance and sort itself out. Historically, there has been underfunding in research into women's health, and as a result, we don't quite understand why some women do better with certain types of treatments like hormone pills over other women. The responsibility for a reliable form of contraception often lies with the female, and so we have a lot of consultations with women about their options for this. The pill, the one that you're taking, we can use it in different ways. We're encouraging women more and more to take it continuously, just because it makes it slightly more effective as a contraceptive, because there's nothing, there's no chance that you miss pills and things, which will affect its cover. But initially, the way we used to use it was for having it for 3 weeks, and then you'd have a week off, and in that week off you'd get your period, and then 3 weeks and then week off, and it would kind of like keep it nicely regulated. And I think that's probably what we need to do, is get you to have a 7-day break from it, and hopefully that might just press the reset button. So we'll do that to start with. And then if it doesn't work, then maybe think about other things that can cause this. So you've had some swabs, it sounds like they were up to date. You've not had a new partner, but we should probably kind of do that as a next step, if just double check that they're still okay.
Yeah, no, that's fine.
Does that make sense?
Yeah, cool.
All right.
Yeah, lovely.
Fab.
All right, thank you very much.
Enjoy the rest of your day.
And you. See you later.
Okay, take care. Bye.
God, it really sounds like it's raining, but Lottie's just out there, so maybe it's not.
As dramatic as it sounds.
Yeah.
Are you in denial? It's not actually raining.
It's not raining, actually. I've decided.
You're just a glass half full person, Ellie.
We'll see. Oh, it's not even raining. Oh, it sounds so dramatic in there.
Sounds really dramatic, yeah.
Yeah.
Sorry, I'm going to shut you in. Hello. Hi. How are you?
I'm okay, thank you. How are you?
Good, yeah, I'm good, thank you. I believe you're here to see Dr. Shah.
Yes.
Brilliant. If you'd like to sit down. Amazing. It's been quite a miserable Swindon morning, hasn't it?
Typical Swindon.
Oh, no.
It's not all that bad. It's not as bad as it's made out to be, is it?
So. How long have you lived in Swindon?
I actually only moved here last week.
Oh my goodness, you're even newer than us.
The worst part of Swindon is driving.
Right, so many
No one knows how
roundabouts.
to use roundabouts. It's so silly, isn't it?
Wow, well, there's so, like the magic roundabout, I think it's called.
Have you been on that?
But it's like a roundabout with roundabouts.
It's a big roundabout with 5 mini roundabouts, 5 or 6 mini roundabouts.
But why though?
There's just no need, is there?
Who thought that was a good idea?
No, I know. Even some of the roundabouts actually go in the same direction as well. I don't know.
Hi. Chloe?
Yes.
Yes, hi, I'm Dr. Shah. Come through.
Hello.
Have a seat.
Hello.
How are you doing?
Not too bad, thank you. How are you?
Okay. I saw the photos just now.
Oh, you've looked at them, okay. Yeah. Have you ever heard of HS? You probably have, yeah.
Yes.
So it's lifelong, nothing they can do to get rid of it, but there is obviously stuff they can do to calm it down.
Chloe came to see me because of her HS, her hidradenitis suppurativa condition. About 1 in 100 people that have it. This includes milder cases. In Chloe's situation, it was not a mild case. She's had it for a number of years, and it starts as kind of cysts, spots, and hair follicles that are blocked, and then you develop abscesses. The problem is it can scar and it can leave tracks in the skin.
I have got a couple on there at the minute. They do need to come off because they're literally they're full of pus and blood.
Okay. Has it opened up? You said you've lost
I had one on my arm that looks like it's got a sack of fluid around it.
Right.
That's only gotten bigger. It's almost like the size of a golf ball
this
morning. And the top of my arm is like extremely swollen. In an ideal world, I just want it sort of dressed for today because it is so painful.
All right. So let's get you up on here, and then we can have a look and see what's going on in a moment. Okay. Now, right. So we've got it. Which one leaked lots today? This one or that one?
They're all leaking, all of them. I can't pinpoint one that's not.
I mean, what's good is there is no redness surrounding it. You know, when there's a definite skin infection around it, you don't have that, so that's quite good. And is it painful when I'm pressing?
No, but now there's one leaking as well. That's a new one.
Oh dear. Is that sore?
It all is. It feels like almost someone's cutting my skin.
Yes. HS is a condition that is treated in lots of different ways. Lifestyle is important because smoking and being overweight are factors that can make it worse. Actually, sweating can make it worse. So a lot of lifestyle measures can really help. Other treatments include antibiotics, and there are creams, and there's even newer, stronger biological treatments as well. These specialist treatments can only be prescribed by a dermatologist, which is why it's really important that Chloe can get to see a dermatologist and they can try and treat her with something that might work, because nothing had worked so far.
I'm also trying to lose weight as well, because obviously they say like obesity makes it worse and smoking. I don't smoke, but
Oh, that's good.
you know, they say it makes it worse,
What
don't
are
they?
you doing? How are you trying to lose your weight?
Right, so my partner's dad, he lives off, and you're probably going to sit here and tell me that it's stupid. 5 days a week he eats chicken and rice.
Okay.
Not just chicken and rice, veg as well.
Right.
And that's what he wants us to do, and then he wants me to go to the gym with him.
So that's
yes,
your plan? That's
that
what
is,
you're
we
gonna
do have a plan together,
So there's
yeah.
a food plan and the gym plan
And a gym
to
plan,
exercise.
yeah.
Good. It sounds like your plan is great. It's a horrible condition.
It is, unfortunately.
How is your mood at the moment?
I mean, I was diagnosed with depression and anxiety anyway. I was on citalopram for a while.
Yeah.
And then obviously I moved, and they don't have my prescription yet, so I haven't actually taken them for a while.
Oh no. Okay.
Yeah.
With this at the moment flaring up, I mean, it makes sense you should be taking something again. I mean, what do you think?
I mean, I would like to, but you know.
So let's start you on again, and then we should kind of arrange a follow-up with a nurse and then get that side of things going.
Yeah, I will do. But we'll get there one day, won't we?
Indeed. Here you go.
Lovely, thank you very much.
No problem.
Thank you for your help. Thank you.
Have a lovely day. I hope you settle into Swindon.
Oh, fingers crossed.
A condition like this is lifelong, very difficult to manage, and it will go up and down in many ways. But that's where the old adage of doctor as drug is very important, which is where actually seeing somebody who's listening to you really helps. I was wondering if I could just run her past you. She's a patient who's got this condition called hidradenitis suppurativa, HS, which is a horrible condition. And what it creates is kind of cysts and boils, and then they bleed and pus comes out. And it's really quite extensive. And she has been depressed for a while, and she knows that. But I was just wondering what would be the best way to get her slotted into your system so that there's a kind of follow-up and a plan.
Okay, so if I see her in 2 weeks' time,
yeah,
and I can review her, see how she's getting on with the escitalopram,
yeah,
then I'll see her again a few weeks later, and if we need to increase the dose, right, I'll book her in and send her an appointment.
All right, thank you very much.
All right,
great,
thank
thanks,
you.
Susie. Right.
Hi, Mrs. Jinks.
Hello.
Hi, I'm Dr. Khan. Come
Hello.
in.
Thank you.
Come take a seat. How are you doing?
All right, thank you. A bit warm, isn't it?
It is, indeed. How can I help?
I've got a problem with my ear. You know how your eye twitches sometimes when you're tired?
Yeah.
I've got that in my ear. It used to happen every now and then.
Yeah.
But for the last few months, it's been getting progressive, and now it's happening every day, about 7 or 8 times a day.
Okay, how long does it last when it comes on?
A couple of minutes.
Okay.
And then I get a pain that comes down there.
Yeah, okay.
And sometimes, if I'm having a hot turn at the same time, I get a bit dizzy.
Okay. Is it affecting your hearing?
I don't think so, no.
No. And you mentioned it twitches. Can you hear anything when it's
Oh, God,
happening?
yes.
Yeah?
Yes.
What does that sound like?
Crackling, like a crackly noise, and it's,
Okay.
It's weird.
Do you mind if I have a look? Is it stopping you from doing anything you would normally be doing?
No, nothing stops me from doing what I'd normally be
Good.
doing.
I like to hear that.
Just get on with it.
I'll have a look in your good ear first. Okay. Look at this one. Okay, first of all, you've got very clean ears, so that's good. Right, normally the eardrum should be a nice pearly white colour, and the light that we shine in should reflect that quite nicely. Yours is very dull, and that suggests there's fluid behind the ear in the tube that connects the ear to the nose area. I suspect what you're hearing is the bubbling of that fluid behind there.
Yeah.
We can give you a nasal spray, which is the best way to get to that tube, which will resolve this problem, but it can take up to 4 weeks to resolve.
Right, okay.
Does that make sense?
It does.
Yeah. Go on. No, it is warm in here, but if you're having a hot flush.
It's a normal hot flush.
How many of them do you have a day?
Oh, about 30.
Menopausal ones, are they? Are you on something for that? Is that something you might consider?
Well, I've been to the doctors and they told me because I'm overweight that I can't really go on anything.
That's not necessarily true. Tell me about your menopause. When did it happen?
When I was 45. I'm now 53.
And so that was the last time you had a period was when you were 45. Yeah. No bleeding since then at all.
No.
And what are your symptoms? I can see one now. Anything else?
Sometimes when I'm having a hot turn, I do get a bit panicky and a bit like short of breath.
Yeah.
But no, that's it.
Do they keep you awake at night?
Oh God, yeah.
Yeah. Would you consider having something if I told you it was safe to have?
If there was something I could have.
Yeah. Gosh, you look so desperate. Okay, being overweight is not what we call a contraindication for HRT, hormone replacement therapy.
Right.
Are you okay? Sorry, you look a bit emotional. Let me give you this.
Yeah. Sorry.
No, tell me what you're thinking.
Just, I've always been told that I can't have anything.
The menopause, I'm sure you'll know this, but I'll just whiz through it. It's called, what I like to think of it as a hormone deficiency syndrome. So your estrogen levels just drop down, and that causes all of these symptoms that you're having. Now, in the past, there were lots of concerns about HRT causing all sorts of things, but actually recent research has shown that HRT is safe. And provided you haven't got kind of breast cancer symptoms or anything like that, we do recommend that you check your breasts regularly, at least once a month for any lumps. And if you notice anything, come and see us. And we like to check your blood pressure every year when you're on it. Now, I think you'll do really well on HRT, I really do. I think all of this will really resolve. I know you should have had it sooner, but we can get it started today. Some women like to have a bleed every month, and there are tablets that you can take which you stop for a bit and have. I know. I have to tell you about them. Some women do like that. I am a man. I don't know.
Rather not. That's the only part of the menopause that was any good.
I will. So you can start them straight away. I'll send them to your chemist. You should have it tomorrow.
Thank you so
My
much.
pleasure.
Come here for me and go out with her.
I know.
Got time sorted as well.
I think you'll do well on it.
Thank you so much.
Oh.
Wow.
Come here. Hopefully this will solve a lot of that stuff.
Oh, I hope so.
Right, it's a tight squeeze. There you go.
Lovely.
Cheers, have a good day. Bye-bye. Bye.
Let me see if you can sit on the seat like a big boy.
Hello. Aren't you gorgeous? Oh, that's lovely. What a beautiful little girl you are.
See if you can hear my heart. Theo, can you hear me? Yeah. I think you'll make an excellent doctor.
Oh. Do you want to have kids?
I think so. Not now, but I do.
When?
Early 30s?
How many?
Something like that. At least 2, maybe 3.
It tickles. It does tickle, doesn't it?
I had 2 children today, so that was nice.
You had a cute
yes.
baby, didn't you?
That's
I saw them
that's
coming
my
out.
special interest. So yes, I felt much more relaxed with the babies.
I just did a poo-poo.
This is a poo.
Can you do this, Blair? You do it now. That is a good tongue.
Is it a caravan?
It's like a... I guess so, yeah. Cool, this one. Go on in, up you go. Hi, you all right?
Hi. Welcome to the mobile surgery. How are you?
Sorry we're late.
Don't worry at all. I believe you're here to see Dr. Shah.
Yes, brilliant.
Amazing. If you'd like to take a seat.
Brilliant, thanks very much. You take a sit down. Oh, there we go.
You've been at school today? Yeah, how was it?
Good.
It was good. What year are you in now?
Year 1.
Year
Year
one.
one.
Amazing. So at a big school now. Yeah.
You're one of the littlest though, aren't you?
Yes.
Yeah. Noisiest though, eh?
Oh, excellent.
Hello.
Hello,
Hi,
how you doing?
Ruben.
Yes, this is Ruben.
Hello, do you want to come through?
Go ahead. After you.
Hi, I'm
Hiya.
Dr. Shah.
Dr. Shah, nice to meet you. You can sit down.
Okay. So, how can I help?
So Ruben, on the 12th of August, had a tonsillectomy and grommet put in his ear.
Yes.
While he was in surgery, they drained the fluid out of his ear.
Yes.
They did say it's quite a substantial amount, and they were surprised he could hear. This week, he's gone back to school.
Okay.
And he's now complaining of almost earache. I have noticed him sharp noises, sort of puts his hand up to his ear.
Okay,
Like
so
with,
sensitive.
he's got a sister, and if they're like playing or squealing,
Yes.
you can see him sort of wince, and he hasn't moaned about too much, but he's also been very grouchy.
Any fevers or anything else?
Not that we've noticed.
Okay, so grouchy but no fevers. Eating?
Yeah, he's always eating.
A normal amount is not
Yeah,
dropped.
I think
or
so,
anything.
yeah.
Okay. Any other symptoms? Anything else going on?
Not that we've noticed.
Okay, so any congestion, nose running?
To be fair, after the tonsillectomy, because it was to do with his breathing and he has slight sleep apnea at night, well, quite severe actually.
Yeah.
He's much better. So much better. So
Oh,
much
very
better.
good.
So it's
Good.
really,
So it's been effective.
Yeah, really effective. Yeah, really effective.
And that was 3 weeks
Yeah.
ago, a bit more maybe?
Yeah, a bit longer.
3.5. Oh, Ruben, how's your ear today? Is it sore, Ruben? Where is it? Show me where it's sore.
Inside.
Inside. Okay, Ruben, for me to have a look at your ears, I'm going to start with your one that doesn't hurt first, okay? All right?
Come over here.
I'm just going to have a look in your ear. How's that? Okay, that's fine. And now I'm going to actually turn you this.
Does that hurt?
Excellent. That's fine. So, I'd like to look at the throat and just see if there's anything. You're good at this, aren't you? All right, let me have it. And can you go, ah? Okay, I'm going to touch your tongue with this, okay? Ooh. And again, go, ah. Okay, that looks fine. The throat doesn't look swollen, so that's good.
Yeah,
so I think that operation has done its job. There's no kind of build-up of swelling there, which could be blocking the eustachian tube, that tube that connects to the ear. So that's a good sign.
Brilliant.
Secondly, the ear itself, inside, the grommet is in the right place.
Brilliant.
In the eardrum. Okay. The eardrum is between the middle ear and the outer ear.
Okay.
And the middle ear is the one that connects to the back of the throat.
Right.
So the problem he would have had before was that middle ear, that eustachian tube, was so much full of fluid that they drained that. That was the one they had to drain.
Right, okay.
And then they put this tube in there, so if any more fluid built up, it would continue to drain out. And that's the whole point of the grommets.
Brilliant.
So I think that bit is working.
Okay.
What I did see where the grommet is, it's quite red all around
Okay.
it. And it is 3.5 weeks ago that it was put in.
days,
So
okay.
you might see inflammation there normally.
Okay.
But the fact that he's got the pain might imply that there's an infection where that is. So it's, in a way, it's like an outer ear infection.
Right.
Rather than a middle ear infection.
Okay.
The complication is when you have a grommet in place and you put eardrops in, some of that will go through into the middle ear.
Okay,
so you have to be very careful with what sort of drops you use.
Right, okay.
And what we would do is normally a 5-day course of a spray.
Okay.
Typically it's 3 times a day. And I think continue with the normal Calpol that you are for pain when you need.
Brilliant. Well, thank you for looking. Thanks for the time.
No problem. That's all right.
Yes, thanks for your time. Cheers.
Okay.
Thanks. Cheers.
Oh,
See you.
all right, then. Bye-bye.
Bye-bye.
Hello, Diego.
Yeah.
Hello, I'm Susie.
Hiya.
Do you want to come on through?
Yeah. Okay. Right. I'll take care, mate.
Come on in. Take a seat.
Thank you.
Thanks for coming in to see me.
It's all right.
How can I help you today?
I came here before for an appointment, but I get a lot of tension headaches and I feel like my head's on fire sometimes. It might be a lot of psychological stress, I think.
Okay. Let's see if I can help you with that. So tell me how you're feeling at the moment. How is your mood?
Sometimes feel a bit brain dead, like stress. It's a lot of tension around, like a cloud around my head sometimes, like a fog.
And how long have you been feeling like that for?
Quite a while.
So you've got a lot of things going on that you need to offload.
I tend to overthink a lot as well.
Okay. And who do you live with?
My parents and my younger brother.
Okay. Are they supportive of you?
Yeah.
Yeah, okay. So have you got friends around you that you spend time with?
Yeah.
Okay. So does everybody around you, your friends and family, know how you're feeling with regards to your stress levels?
Yeah, my parents know.
Okay. Yeah. So you can sit and talk to them if you need to?
Now and then, yeah.
When you're at home, do you spend a lot of time on your own in your bedroom?
Yeah, I usually spend a lot of time on my own. And we've got a little dog now.
Okay. What, a puppy?
He's a Shih Tzu. I think that's how you say it, Shih Tzu.
Yeah.
Sorry.
It's okay, it's not
He's sweet. He's sweet, yeah.
So do you take him out for a walk every day?
I take him out now and then, yeah.
Okay, so that gets you out in the fresh air. Okay. So how often are you feeling this stress and this?
It's usually every day.
So it might be that you just need to inject some mental health care into your daily routine.
There is a concern I want to mention.
Okay.
I'm vaping now. I used to smoke.
Okay.
I'm trying to cut down a lot, to vape. So I vape more now. But I need to be 3 months clean before I can start my hormone treatment.
Okay.
I don't know if you know if I'm trans or not.
Yeah, I did read that in the notes.
Okay. I think that's a lot of it as well. Okay. The stress of that.
Yeah. It's a lot to take on, isn't it?
I'm taking on a lot at the moment.
You are. And that's why it's important that you have some time to sit and talk to somebody, an hour every couple of weeks, and talk to a therapist about what's going on for you.
I think I need that. It's been a long time.
Yeah. What I can do is text over some details to you.
That'll be lovely.
Of somewhere else that you can access some therapy.
Okay.
You can make contact with them and book in your first session. Okay. And what they'll do is talk you through what's going on for you and how they can best help you and go from there. I think that's very important for you because you need to empty your head a little bit.
Yeah, my head needs to get a bit healthier, I think.
But you're doing all the right things. You've got a good foundation there. And I've got no problem with you coming back to see me again.
Yeah, I think I'd like it. It's nice.
Yeah.
What's your name again?
Susie.
Susie, thank you, Susie.
All right.
Yeah, you take care. Thank you. Oh.
Hello.
Hi there. Is it Colin?
Colin, yeah.
Good appointments at 11:30 with Dr. Sam Savage.
Okay.
Yeah, that's brilliant. If you'd just like to take a feed for me.
Hi there, is it Colin?
Yes.
Please come through, Colin. Do you mind me calling you Colin?
No, that's my name.
My name's My name's Sam. Sorry, it's a bit of a squeeze getting through there. Anyway, nice to meet you. What brings you here today?
I'm getting lots of warts come up on my neck.
Mm-hmm.
And they're becoming uncomfortable. And I don't know if there's anything that can be done.
Is it just around your neck?
Well, one come up on the ear. Look, I don't know if you can see the mark where it was.
It looks like a little exploration around here.
It's when I wear a shirt with a collar. It's
getting sore. Do they bleed at all?
No. But I just wonder if there's any cream or anything that can sort of need to stop them or...
I mean, the good news is it's not anything serious, okay? They're not sinister-looking skin problems. It doesn't look cancerous or anything worrying like that. But they're not easy to remove, and unfortunately, the NHS doesn't provide that service right now. In terms of trying to avoid irritation and avoid the sort of them getting sore or rubbed by your shirt, I would recommend just using a simple emollient cream just around your neck, just to keep everything nice and healthy and soft. Because if your skin's generally dry and irritated anyway, then it's just going to get more sore when those things are rubbed.
Yeah, fine, that's good.
There isn't a quick win, I'm afraid.
I just wondered whether there was. I wasn't looking for, I didn't think there would be honest with you. But I've got more serious things wrong with me, so I think I can put up with this.
Okay, I'm glad to hear that.
My heart diagnosis isn't good, so one of my chambers in my heart's not working properly, and there's nothing they can do. So,
How long have you known about that?
6 months.
It's an extremely important thing.
Well,
to,
I mean, the
to be
doctor was
managing
quite
properly.
honest with me. He said you could go tomorrow, or you could live 10 years. So.
When I run a lot, my heart and here it stops really hurting.
Okay, just going to check your pulse.
I've got palpitations as well.
If these palpitations are happening more often, then we might be starting to think, is it palpitations from your heart?
Still beating, that's got to be a good sign.
It's good, yeah, exactly. I'd like to listen to your heart and breathing because you've mentioned, you know, it feels a bit tight there.
It feels like a bit of a band across here.
Ah, does it?
But it's only a short period of time.
And from the heart point of view, how are things going there?
Still going. I think.
Right.
Hello.
Hi.
How are you?
Good.
Seeing Dr. Beecroft, if you want to take a seat, she'll be out for you shortly.
Thank you. Hi, is it Lola? Yeah. Hi, come on in. Come and have a seat. And Dr.
Thank you.
Beecroft, hi. Are you Mum?
I am Mum.
Great, welcome.
I asked for the appointment today because yesterday Lola felt quite unwell. She feels quite unwell a lot.
Okay.
When I say what's going on, you usually feel dizzy, sick, headachy. She nearly passed out the other week in the hairdressers.
Okay.
We are waiting on a referral appointment from the Pediatric cardiology team.
Yeah.
And that's due to her having some seriously fast, like a racing heart, wasn't it? But she says sometimes it beats really big, and then that's what. Yeah. So it's trying to see whether this not feeling good is potentially linked with what could potentially be going on in her heart. We have no idea.
Or, you know, we just... So it's lots of different bits, trying to put all the pieces together.
We are trying to put, because obviously as a parent, I don't want you to keep missing school. I want you to have a happy, healthy childhood, really.
Yeah, exactly. Because how old are you now?
12.
12, okay. I'm going to be really picky with what you're saying. So what doesn't feel right?
It feels like it's beating bigger than it usually does.
Fine. So you can feel your heartbeat beating and it feels like it's a bit of a stronger beat than it should be. Okay. Does it feel like it's going quick though?
No.
No. And does it feel like it ever stops and then suddenly starts again?
Not really.
No. So it's just something that you're aware of with it?
Yeah.
Yeah. Okay. When that happens, does anything else happen that you've noticed?
Sometimes it makes me feel a bit dizzy and like lightheaded.
Have you passed out at any point with this?
So in the hairdresser, that was nearly, wasn't it?
Oh, it was awful to see, actually. She was stood up. I just watched the colour fall out of her face.
Have you started your periods yet?
Yeah.
And kind of thinking back to when you were at the hairdressers, do you think you were on your period at that time at all? No. Alrighty. Should we do some tests and see what we think's going on? Okay. So you've had your blood pressure done before by the sounds of things. And can I ask a little bit about your periods? Are they coming kind of quite regularly?
Yeah.
Yeah. And are they particularly heavy or bad? Yeah. And how's anything that you're taking for that when they happen?
All that we really offer is a bit of paracetamol, really, most of the time, isn't it? Periods are so heavy for a 12-year-old.
For young women, periods can be a real problem, and so making them feel at ease and be able to talk about that issue so that they can get help to manage that's really important. It can be really difficult for some women each time their period comes. They can take time off school, which can affect their education, and it can be really disabling for people.
Diet-wise, are you vegetarian, vegan, anything like that?
I don't like red meat.
I know. If you're not eating maybe as much red meat as you used to, and your periods are more and more of a nuisance, then the balance is the wrong direction.
Yeah.
Because I was just looking back at your blood test results, so they were done in April time, and your blood count, your red blood cells, is okay, but your iron level is right at the bottom of normal. And when we're having heavy periods, you're losing all of that each month, and your body needs iron in the diet to make the red blood cells. We might actually need to think about repeating those blood tests to see, has that got any worse? In which case, if you're a little bit anemic as well, that's coming into that, that will also be adding to all of these kind of symptoms and things that you've been having too. it's all complicated and it's all a bit interconnected.
But yeah, it sounds like it is very much interconnected.
Well, credit to you for taking all this in your stride.
I mean, as soon as I have anything I think quite, anything seriously right, I straight to the doctors.
So the next goal, I'm thinking, is there something that I could add to help you? I'm sort of not helping you a great deal with your neck, but is there something I can do to help with the management and stopping the heart failure getting worse? Because your muscles are struggling a little bit, and I was thinking the next step from my point of view would be adding in a bit more of the bisoprolol. Have you been on a high dose of bisoprolol before?
5 mil I'm on, I think.
Yeah, that can go up to 10, and that's actually quite good at slowing down the heart rate, improving the efficiency.
I'll try anything. If it means increasing something that's going to help me, then...
Yeah, I mean, at the end of the day, you're under the specialist. They'll be monitoring them, putting on the best medication, but I generally, as a principle, want you to be on the highest dose of bisoprolol. I'll send the new medication, the new dose. We can just take 2 of the 5s for now. Right. Hopefully it doesn't get any worse. If it does, or you're worried about it in any way, if things have changed, come back and we'll have another chat.
Thank you, Zach. Thank you very much.
Nice to meet you. Take care. Take care.
Okay, thank you. Cheers. All the best, thank you.
So I think we should get you to have another set of blood tests to see, are you anemic? I was wondering whether we prescribe you something different to try with your next period to see whether that makes it any better. Okay. So I'm going to prescribe a medication which works a bit as a painkiller, but also it should help reduce the heaviness of your period. And you take it just when you're bleeding, and you can take paracetamol as well with it, but not ibuprofen because they're kind of similar drugs. Right, okay. And that will hopefully give you some relief, and then we can see how you get on with the next period and whether that works for you. And then if it does, great, we can just keep doing that month by month. And if not, we've got lots of other options that we can try. So I will sort out a prescription and just send it through electronically there so you can go and collect it from them.
All
Is
right.
that okay?
Thank you very much.
No problem. Nice to meet you both.
And you.
Enjoy the rest of the day. Looks like the sun's out.
It looks like a really nice day. But unfortunately, some of us have to work, Lola.
Thanks. Tough when you get older.
Thank you.
All right, take care. Bye-bye. Women come to the doctors for a whole variety of problems throughout their life. I see young people in clinic really regularly, and I feel that they're being able to be more open about kind of matters which have been more difficult to speak about previously. For young women, I think it's really important for them to get used to coming to speak to the doctor and talking about things like periods, because I think it's a subject that you feel always too embarrassed to talk about, and so loads of women then just go on to suffer for ages when there's lots of things that can be done. We really want our young patients to develop a good relationship with their doctors, so we've got to try and create an environment where they feel able to relax, open up and be honest with us.
Bye.
Bye.
I was quite young.
Oh, that must have been really hard.
Wow, an oddity.
Not an oddity.
I need fixing.
What's not right?
My hair's falling out. I've got no zest. The hot flushes, it's just too much.
The only thing inevitable in life is you're going to die.
Yes.
That's why I've always looked at life.